Hey, if you have trouble coming off of benzos and you've already tried switching to a long-acting benzo and doing slow dose reductions as generally recommended, there's something you need to know. And that is the role of phenobarbital that can help you out. The response to benzodiazepine withdrawal is really unpredictable. We have patients who have been using benzos for years, can stop them, no trouble. We've got patients who have used benzos for a week or two and have spent years trying to get off of them. And in general, the recommendations are to switch to a long-acting benzo, something like typically Valium, maybe clonazepam, if you're on something shorter acting like Xanax, and then use that to gradually taper off. You'll see maybe 5-10% reductions every few weeks. And this is the standard of care and is generally recommended. But that doesn't work for everybody. And there are people who've come off that way and months and months and months later still have withdrawal symptoms. Anxiety, hot, cold, agitation, panic attacks, and so forth. So one tool in the toolbox that you should be aware of is phenobarbital. So phenobarbital is a barbiturate that also acts on the GABA system, like benzodiazepines, and also glutamate. And both these actions reduce the excitability of the central nervous system. When we come down using a long-acting benzo, it's like trying to put out a campfire by putting smaller and smaller kindling on it. We're still adding a benzo. We're still using a benzo. So if the goal is to heal the GABA system, there's limitations in using GABA agonists like other benzos. So although it can help with withdrawal and prolong and reduce the withdrawal symptoms, it's not perfect. Using a benzo, you're still using a benzo to come off of a benzo. So it's problematic. So some of these newer guidelines we're using in the clinic and in the programs I work with is we're taking people and we're stopping the benzos and we're using phenobarbital. And so that's something you should talk to your provider about. Is you can use these phenobarbital tapers, sometimes just a few days, sometimes longer, sometimes with an antiepileptic like say valproic acid or Depakote. And this really can stabilize the central nervous system, let the GABA system heal while providing that reduction in anxiety caused by both GABA and glutamate. So the next video we're going to talk about dosing strategies, but the point is using a benzo to come off a benzo, although it's generally recommended, has limitations. Some people don't do well with it at all, and those people should look at phenobarbital. Talk to your provider about it, or follow our other videos where we're going to talk about using phenobarbital and exactly how to dose it.